Welcome back, dear viewers. We have with us our guest here in the studios of Hala, Kuwait, Dr-Mai, medical doctor and clinical nutrition specialist. Hello and welcome, doctor.
Hi, thank you for having me.
You're most welcome. So can you please tell us, doctor, how important is one's lifestyle and dietary intake when it comes to battling cancer?
It's very essential. The healthy lifestyle is really important to prevent cancer and also to help them to go through the process of chemo. So it's really important to concentrate on balanced food and healthy diets during the process, and at the same time physical activity and mental health.
Of course, it is very important to take care of your health and your dietary intake. So do different types of food or even drinks affect a patient's chances of battling cancer?
Yes, of course. During the process, for example, if they got cancer, it's different than to prevent cancer. If you want to prevent cancer itself, you should take care of your healthy diet since long time, because it's a preventive case. For example, you should eat balanced food without any processed food or anything with preservative, because it contains salt and also other additives. But if during the process of cancer, if the patient have cancer itself, it's totally different, because they have to have this management and treatment with chemo, and during the chemo they should stick to certain diet planned with clinical nutritionists and also supervised by oncologists, because they might need supplements as well.
Of course, this is very important to take care of your diet and your food before even getting into cancer or even any kind of diseases. It is very important to eat healthy and organic food. And I even read an article once that even plant-based food is very helpful when battling cancer or even any type of diseases, going back to basics and to plant.
Yes, of course. It's because of the high concentration of fibers inside the plants or vegetables itself.
Yes.
And it's proven in scientific articles, like if you eat certain amount of fibers, it will actually help you to combat cancer and at the same time to prevent cancer itself. So it's kind of prevention, and I believe in prevention, because you should prevent it before it's happening.
Yes, of course.
Yeah.
It is very important to take care of your health and help prevent it before it even gets started. So is there a specific type of exercise that might help in preventing such cases? And if yes, can you please tell us what type of exercises are we looking for here?
Just simple physical activity, such as walking or swimming, or just walking with their children anywhere, cycling itself, any aerobic exercise, it will help. But it should be consistent. Some people, they do it just for a while and they stopped it, but they should do it consistently. It should be part of your lifestyle.
Of course, it is very important to manage a healthy lifestyle and not make excuses like you're very busy or you have work or any kind of stuff like that. It is very important to exercise, even if it's 30 minutes a day. This can help a lot. So a lot of people with the toll of advanced stages treatment can be very overwhelming on a person or a patient's lifestyle. So how can you manage to have a balanced dietary intake and still have enough energy to exercise and lose weight?
During the process and management of cancer, if they have it, they will undergo chemotherapy. And unfortunately, it's really knocked down the immune system. And then it will be a struggle for them to eat, because it will affect their appetite and it will cause nausea and vomiting. So it's really a challenge actually for patients to stick to a healthy diet, because they don't have willing to eat.
Yes.
So that's why they should be referred to clinical nutritionists to help them. In the same time, they might need supplements. And in case of supplements, it's really we should be cautious in this amount, because they eat certain amount of supplements which is high in nutrients itself.
Yes.
And it could affect the chemo. And also herbs, certain kind of herbs, it might affect the effectiveness of the chemo. So they should take care of their diets through all the process. But what I'm concerned about the nausea and vomiting.
Yes.
So they should eat small meals a day, and it should be without any oil, any spiciness, and they shouldn't eat and drink at the same time, because it will make the nausea exaggerated and worsen.
Of course,
Yeah.
this is all new information to me. So even when it comes to taking dietary supplements while battling cancer, you must be moderate and take it exactly as it's prescribed, so you don't get vomiting or nausea because of the chemotherapy.
Yeah.
So will the chemotherapy affect a patient's diet?
Yes, because it will cause nausea and vomiting, and
Yes.
it could be like recurrent. And in this case, they will have dehydration, and dehydration is very significant in their case.
Yes.
They might get fainting, unable to concentrate, and they lost their energy. So it's really affecting them. At the same time, it's hard for them to rehydrate. So they might need IV drip in this case. So they should be under supervision. And also certain kind of fruits, it might affect the chemo itself, like grapefruits or the juice of grapefruits, and also green tea.
Yes.
Sometimes green tea, if it exceeds 1 cup a day, it might affect the effectiveness of chemotherapy. So they should be really under supervision.
So you mentioned earlier that people undergoing chemotherapy might get nausea and even vomiting. So how do you deal with such cases?
A certain kind of medication, they should have it, anti-emetic medication. They should take it before the meal. They shouldn't wait until they get nausea. They should take it as a prevention.
Yes.
And it should be before the meal itself. In the same time, they should eat small meals without oil, without spiciness, not sugary,
Yes.
even drinks, no sugary drinks, nothing. They can have water, but sometimes water itself may make the nausea worsen. So I advise them to have slices of fruits. Sometimes it will help them. Regarding the vegetables, it's helpful in the prevention because it have fibers. But during the chemo, because they have low immunity, vegetables sometimes contain microbes inside. You know, the hidden leaves, for example, is hard to wash.
Yes.
So I advise them to clean it properly, because if they can't, no need to eat vegetables. They can have soluble fibers like oats, lentils. It will help them also to strengthen their immunity.
So these are alternatives for not eating vegetables, because
Yes.
the vegetables, as you mentioned, might have some microbes or things that might affect them and even lead them to vomiting even more and getting more nausea.
Yeah.
So is it advisable for people undergoing chemo to be fasting?
No, actually, because sometimes empty stomach, it will make the case more worsen, because it will increase the acidity in the stomach. So I don't advise them to stay fasting for too long. They can have small meals every 2 hours, and very small, and have oats or any kind of soluble fibers,
So
as I'd advise. Yeah.
Did you have any patients that actually had trouble even eating after chemotherapy, that they might be afraid of nausea or vomiting, so they eventually stop eating or even fast because of this recurrent issue?
Yeah, sadly, yeah. I had patients, they have the same problem, and it's really hard actually for them. That's why we might give them IV drip. They might have admission to the hospital in this case. Yeah, some cases really serious.
Yes.
They might end dehydration. So that's why I advise every patient enrolling in the chemotherapy management, they should from first day meet the clinical nutritionist to have a proper plan and to help them to go through the process.
Of course, that's very important to have someone who would help you understand the nutrition that you need to take and avoid what you not take. So what is some of these harmful or even dangerous food or even vegetables, as you just mentioned, for people who are a breast cancer patient?
If they have cancer, nothing dangerous except the processed food and the processed meat, like the turkey, all this kind of meat, processed, frozen, or something like a canned with the preservatives, because it has nitrates. Nitrates is also a carcinogenic.
Yes.
So they should avoid anything processed. I advise them to eat organic, healthy food. But the vegetables, only my concern about cleaning the vegetables, if they
Yes.
can, yes. And cooking itself, they should cook above 150 degrees in the oven. they shouldn't have like medium well, or it should be cooked. Nothing like raw.
Yes,
food.
well done.
Yeah,
It
well
has to be
done
well
this
done,
time.
yes. So can you say that one's lifestyle can even help prevent future cancer or any type of diseases?
Yes, because recently science found like obesity is a major risk factor for cancer itself,
Yes.
and it could be preventable. So if we compete obesity, I think it will have an impact in preventing cancer. And breast cancer actually is the third common type of cancer, and is really getting worse even in Kuwait. We noticed that it's all because of the unhealthy living.
Of course, because we have a lot of restaurants here and a lot of junk food is presented even to the kids. So even when they're growing up, this will affect them drastically. So this is one step to take it, is to quit junk food, focus on a healthy lifestyle, and eat healthy nutrients as well.
Yeah, of course. That's why education is really important, to educate the community about the importance of healthy lifestyle as kind of prevention.
Of course. Thank you so much, Doctor. It's a pleasure to have you with us on Hello
Thank you so much.
You're most welcome. Dear viewers, we had with us Dr-Mai Al-Hazza. She's a medical doctor and clinical nutrition specialist. Moving on to our next report, it's about Kuwait heritage. Let's have a look at it. Stay tuned.